We actually changed our name. We have been community medical centers, and we've changed our name to Community Health System because it represents the growth in this organization. Not only do we have hospitals and clinics, we also have our own health plan and our own medical foundation that allows us to partner directly with physician groups to provide the best care we can for our community.
At the heart of it, we are medical centers. We have 3 large medical centers, but we are not just medical centers. We have a large network of outpatient clinics and a large setup of post-acute services. We run one of the largest home health agencies, a skilled nursing facility.
Community is the largest health system in the region, and that means there are more nurses, more doctors. Really, I think we are the single largest employer in the valley. And if you look at a health system, it absolutely takes a village. So the doctors, the nurses, the employees, everybody. This is one giant family.
If you take California, community is unique in its size and also in its ability to be local and to self-govern.
We provide a diverse set of services and care for a very diverse community.
Within community medical centers, we have Community Regional Medical Center. It's a level 1 trauma center. It's the largest hospital between LA and San Francisco. It's actually the second busiest hospital in the state of California. You will find basically no one else bigger out there. Then you have Fresno Heart and Surgical Hospital. It has one of the best in terms of patient experience results in the state of California. And then you have Clovis Community, which is frequently rated as the top hospital in our market.
When I joined Community almost 15 years ago now, we had 5,000 employees. Today, we are well over 8,500 with a plan to actually grow by another 1,000 in the next year. And this growth is because of the growth of the organization. So all of our facilities have expanded during the time that I've been here, adding more beds, and that is due to this community continuing to grow.
As your career is continuing to progress, and if you wanted to move from the hospital to the insurance or to the foundation side, it isn't as if you're joining a new organization. Your career, all of the benefits, the PTO, your retirement, all of those things continue to grow with you.
So by giving employees more choice in different organizations, it allows them to find what they're looking for without having to leave the organization.
I've seen, while I've been here, a frontline environmental services housekeeper work their way up to being a sterile processing tech, to then working their way up to being a nursing assistant and to being a registered nurse. And so, you see that at all levels in the organization of community helping support growth in one's career.
There is a culture to this organization that I've never experienced. I feel like I am part of a team. I feel like I'm part of a family. I know that the decisions are being made locally. They aren't being made by some corporate entity in some place where I've never met people.
It's not too big and it's not too small. We're not so small that you don't have the resources you need as a caregiver or an employee. We have the financial resources and the backing to make sure that you have what you need. But in reverse, we're not so big that your leadership team and those you look to are sitting 200 or 2,000 miles away, that you oftentimes worry are disconnected from what you need in your role.
Community decided to do their own health plan because I think it's a commitment to being local. You're not going to get that with any other national plan. They don't know the doctor. They don't know who the GI doctor is. They don't know you.
On the academic affiliations, Community Medical Centers is affiliated with the University of California, San Francisco, UCSF. They are one of the top 5 every year medical school programs in the country.
When it comes to work-life balance, we offer a very generous paid time off program, as well as separate time off specifically for illness. We do provide tuition reimbursement. We also provide reimbursement for professional certification obtainment as well.
What I like about Fresno is that it's one of the largest cities in California, yet it has a very small town feel.
So I've lived in the Bay Area, I've lived in big cities, and there's something special and unique about living in the Central Valley. Part of it's convenience. Everything in the valley is 15 minutes away. You don't have to deal with traffic. You don't have to deal with a lot of the headaches that you do in a big city.
Part of what makes Fresno and Clovis so special is you are at the doorstep of everything. I can be in San Francisco one weekend, you could be in LA the next weekend.
And we are only a short drive from the nation's 3 top national parks, one of them being Yosemite. To get to the Central Coast and the beach, a couple hours away. To get to the mountains to ski, maybe an hour. The perfect location to enjoy that active outdoor lifestyle.
Great school districts across the board, and engaged. You have teachers and educators who are absolutely engaged with the parents because we're all part of one community, and you get that feel here in the Valley.
We are in the nation's breadbasket, where the best produce is grown, and that produce shows up in our restaurants. But with the diversity of the community that we live in, we get to experience the best food.
I can't see myself working in any other organization, and a big part of it is the people I work with every day. I'm part of something. I'm part of a family, part of a team. It's exciting, and that's something incredibly special, and it's part of when we come to work every day. You aren't working with colleagues or strangers. You're working with neighbors and family and friends and taking care of those same people.
In this next year, we will have well over 1,000 open positions, and they will be across all job families.
And that is why we need you. We need great people to come join the team. We are growing quickly, and we would love to have you join the family.
Take a look at Community Health Systems. I think we have it for you. We care for people caring for people.